Good morning. So today we're going to talk about a concept that is really integral to the kind of work that I do as an energetic kinesiologist and is really fundamental to a lot of the holistic health modalities and concepts that people work with. And this concept has to do with yin and yang integration and balance. We're going to start by talking about this in a slightly more general sense, but then really focus in on how this affects brain body integration and alignment, and how this also applies to things like hormones, since a lot of you will have landed on this video after being part of the summit that I did online, where I was talking about the concept of empowered estrogen. So we're going to talk about these concepts and then also look at a technique that you can use to balance yourself and maybe others if you have the muscle testing skill set so that you can help to bring this into better alignment for people in your life. Of all of the corrections that I've written for various courses, this is one that I get a lot of feedback on. A lot of people really love it because it is simple and it's very effective. So let's go ahead and get started. I'm going to share some slides here with you. So when we're talking about this concept of body-brain integration and yin and yang, most people are really familiar with an image like this, right? This concept that we see of the duality of nature. And so people see this image and they think of things like the masculine and the feminine, or of good and evil, or of light and dark, right? And we understand there's a few things that are intrinsic in this symbol. So one thing is this concept that in anything there is an element of the other. And what I mean by that is even in the heart of the yin here in the dark, we see a little bit of yang. And at the heart of the yang, we see a little bit of yin, as in nothing is 100% yin or yang. Everything can be further subdivided. There's also a feeling of movement when we look at this image. So the division between them, it's not a straight line. This could be a straight line. We could have black on one side and white on the other. It's not. It's sinuous. It's curving. The whole image is constantly in motion. And it reminds us that in nature, we move towards a state of balance, ideally, right? So at the moment when something is its most yang or its most yin, it starts kind of moving into the next phase. And we see this in natural cycles. We have a body rhythm, like a circadian rhythm through the day. There's that concept that like it's always darkest before the dawn, right? As soon as we hit the darkest point, the light starts to come back. We see the same thing when we look at a year cycle, for instance, right? As we progress through the seasons, we see this in a life cycle. And so we also see this in various hormonal cycles, as well as thought cycles and things like that within the body. But this is a basic concept. So when we start looking at yin and yang within the body, there are so many different things that this entails. Like, yes, the masculine, feminine, the light, dark that we were talking about before. But there's other concepts here as well. So this is a basic kind of list that we often go into in class. And when I teach GEMS Elementals, we go into this in detail. We spend a lot of time talking about these concepts of yin and yang. We don't really have time today to go into it in too much detail, but just take a look at the lists for a moment. The idea that the yin is deep, soft, always working in the body, as opposed to the yang, which is more superficial, hard, dry. It's more about transitions in the body. We start to get a feel for how things like our organs, our meridian system, these different channels of energy and movement of energy within the body, they all kind of fall into the category of one or the other. They're all more yin or more yang. And so this is a way of kind of classifying and understanding better the functions of different parts of our body, right? Today, we're looking at a very specific aspect of this. So moving out from yin yang for a second, we're going to talk about something called the five spirits. And again, this is a big concept. We're just kind of introducing it here. But within traditional Chinese medicine, we have the idea of these five elements, right? And you may have seen the five element chart or something like that before. Um, Every element has a couple meridians in it, one that's more yin, one that's more yang. Together they form this element in our body. And then each element also has something that they call the five spirits. And so the spirits are, it's a tricky concept to try to explain quickly, but you can think of them as what would enliven the element. So when we talk about something like wood, right? We know that I don't have literal tree or a literal fire in the body. We understand that these things are metaphors. They are concepts energetically. The spirit is what takes that concept and kind of makes it into the energy that we are able to use and that we were able to process and metabolize in the body. So there's a gift, there's a power, there's a resonance that we see with each one of these spirits. And we're going to focus on two of them today in order to take a look at how this affects body-brain integration. The two that we're going to look at are the Po, which you can see here in the middle, is part of the metal element, and the Han, which is part of the wood element. Now, the reason why I'm focusing on these two at this moment in time is because these are kind of opposing aspects of our own spirit, if you want to put it that way, or our essential self, our soul, or energy. So the idea is that the Po is about the grounded part of our energy. So this is the part of my spirit, my essence that is in my physical body. And when I die, it goes away. So we can also think of this as the most yin part of our spirit or our energy, right? Because it is grounded to the corporeal structure. It's grounded to our physical cells. Um, so this is really centered. It's earth energy. This is one of the vehicles that allows us to be grounded, right? And then the Han is more yang, heavenly kind of aspect of the spirit. So, depending on your belief structure, this might be the part of the spirit that would go on to an afterlife after death, or would be reincarnated, or it's the part of you that lives on through your lineage, right? Or through your reputation. This is my legacy, right? So it's the energetic part that is outside of your physical structure, whether it's outside of because of some kind of afterlife or whether it's outside of because you still live on in the memories of the people around you. So we have these two different aspects of the spirit. And they kind of thought of these two aspects as being like poles. So in kinesiology work, we talk about polarity a lot. And it's because we're seeing the body as an energetic structure. And if you understand the way that energy and electrical circuits work, you understand that we need to have sort of opposing polarity, right? So you can think of the Po as being the most yin, the negative polarity. It's really grounded and it's locked to the earth. You think of the Han as being yang, positive polarity. It's the most universal, right? It's up here. Ideally, our energy works like this is an oscillating circuit. So it clicks back and forth, allowing for this energetic balance and centering. So my energy gets grounded and then it is enlivened, right? And the two work together. So you can imagine that when we're in perfect balance, we're able to access both, right? And we're able to do this in whatever way makes the most sense for what we're doing that day. So some days I might need to be a little more like centered, right? And other days I might need to be a little more creative and in touch with these universal energies and those sorts of things. And we should be able to do both. There's a concept, however, in traditional Chinese medicine that basically says that there can be a disconnect. So if the yang energy starts spinning a little too much, right? This is a oversimplification, but we're going to take it. We end up with too much energy kind of up here, and we're stuck up here. And the opposite can happen as well, of course. If we are having to focus too much on the physical needs, the physical body being grounded, we can kind of get stuck down here. And this is the root in that theory of a lot of what we would call mental illness today, right? And this kind of makes sense. Are we in a spot where we are anxious and where the mind is spinning and all the energy is up here and we can't even think about our physical body or something like that because there's just too much going on. So this kind of overwhelm or something like that. Or we can be stuck in our physical, and this might look like depression, right? Or lethargy, the inability to kind of take ourselves up out of this energy and see the bigger picture and feel enlivened, or like there's something beyond just whatever I'm going through right now. So you can see how these imbalances can show, right? So if these imbalances show in this way, what might we want to do about that? Well, let's go back in here for a sec. So, one of the ways that I like to work with these imbalances is by working with the central vessel or the conception vessel, energy meridian in the body, as well as the governing vessel. Now, again, we could talk about these extraordinary meridians all day, but we're going to look at them as a really brief overview here. You can think of the central vessel as being the overall regulator of yin energy in the body. And you can think of the governing vessel as being the overall regulator of yang energy in the body. And so if the two are not in balance to each other, then this can manifest in all kinds of imbalances between yin and yang, including this disconnect between the Po and the Hun that we were just discussing. But also, I said we were going to take this back to things like hormones for a moment. So if you heard me speak in that summit, one of the things I was talking about was how the adrenals and estrogen need to be able to work together in order for us to have optimum health, right? And we can think of estrogen as being sort of the ultimate yin hormone, really. It's the most feminine. It's soft, right? It has a softening effect on so many tissues and things in our body. It literally softens the heart as well as like softening our mind and the way that we think about things. And then we have adrenal hormones like adrenaline and cortisol, which are about energy, right? And being able to be in a fight flight state and being able to have sympathetic nervous system arousal and being able to face whatever is going on in the outside world, right? There has to be a balance between these things. And if we see them start to pull further and further away from each other, we start to experience a lot of the symptoms that we were talking about before. Yes, like the yin yang dichotomy symptoms that we were looking at in the chart, but also some of the stuff that we talked about in the summit, right? So the idea of perimenopause and menopausal kind of symptoms or PMS kind of symptoms, or being in an anxious, overwhelmed, stress kind of state in our day-to-day life. So we can use this technique, like, yes, to bring these two meridians into balance, to bring the yin yang into balance, but also I wanted you to understand how this integration has a ripple effect. It has ramifications in so many other places in our lives. Okay. So actually, let's go back a step here. I just want you to notice where these meridians actually are in the body. So the true name of this is conception vessel, but it sometimes gets called central vessel because of the way it runs up the midline in the front of the body. So this starts down here and runs all the way up the midline. Your last point on the conception vessel that we usually see in charts is here, CV24, just underneath the bottom lip. Okay. And then if we look at the governing vessel, this starts down here at the tailbone, it runs up the back of the body, and it ends here just above the top lip. And I'm just pointing this out because we're going to use these 2 points in our technique as like representatives of how the energy is flowing in these meridian channels. So I wanted you to have a chance to see them properly here. So how do we work with this now? Because I want to give you a tool that you can use to bring yourself into balance. So let me just state, if you have muscle testing skills and this is something that you know how to do, and if you are curious about that, I have other videos on my YouTube channel about like ways of muscle testing yourself. We teach classes here about how to muscle test other people effectively and efficiently. You can challenge these things and look to see where is the imbalance in the body. So usually what I would do in that case is I would have the individual touch at CV 24, light touch. Do we get an indicator change? If we don't get an indicator change, deep touch, do we get an indicator change? Okay. And if this system is at a balance, one of those two things is going to give you a change. If light touch gives you a change, there's too much yin energy happening in the body right now and not enough yang. If the deep touch gives you an indicator change, it means there's not enough yin energy in the body, and we need to bring that into alignment. And whatever indicator change you get when you touch CV, you're going to get the opposite when you touch the governing vessel, right? Because they're reciprocal. So if I have too much yin, it means I have not enough yang. If I have too much yang, it means I have not enough yin. And the point really is to bring these two back into alignment. As a practitioner, you can also have the person challenge governing vessel 29 at the roof of the mouth, and you can see what the integration and connection between these meridians looks like. So again, this is stuff that we talk about a lot more in the GEMS Elementals class, but I want us to have a way of working with this now. If you don't muscle test, that's okay. You can do this correction without knowing exactly how the imbalance is in the body right now. And what I would normally suggest, we're going to work with this together for a minute. Take a moment, if you're going to do this as a correction, to do a quick self-assessment. So notice if you have a lack of energy, feelings of pain or frustration or something somewhere in the body. Do you have symptoms that have brought you here that we were talking about before? And then what you can do is simply make contact with these 2 points for a moment. We're just setting an intention that we are working with conception and governing vessels, and that we want to create harmony, balance, and flow between these meridians. And then you're going to put one hand over the navel, tongue to the roof of the mouth, and one hand at governing vessel 20. And you can go back and look at where that actually is on those meridian charts if you like. But if you just put your hand over the top of your head, you're in the right spot. So now we're just going to stop here for a moment with really a clear intention of working with those two meridians and how they flow and how they integrate. You take a few deep breaths. So if you look at the way that this is described, it says that the client is going to hold over the navel and the tongue to the roof of the mouth. The practitioner will hold GV20 and these alarm points at the ends of the two meridians. Does it have to be like that? No. If you're doing it by yourself, you can simply address these and then hold these points. Also, some people are comfortable with other people touching their face. So if you're working with this with someone else, you can have them touch these points and you can touch the navel and the top of their head, and that's totally fine. Tongue to the roof of the mouth should always be the person who is having the correction done on them. I feel like no one needs to say that. We understand that, right? Okay, just don't get yourself, in trouble there. So usually this is going to take a moment or two, up to a few minutes even, in order to bring this whole system into balance and alignment. And what you start to feel is this circuit of energy kind of flowing in the body. And then when you feel like you're done, you can either muscle monitor to see, are you actually done at this moment? Or you can simply do another self-assessment. So how do I feel now? Do I have less resistance, less stuckness? Is my energy flowing better? Do I feel more energized, right? How does it feel? And that's always the proof. If it helps you feel better, then that's amazing. So, obviously, if we're working with this with a bigger imbalance, like we're working with somebody's mental health, we're working with an estrogen or adrenal imbalance, you're going to need to do this more than once. There's lots of factors that are involved in that, right? It's not like you hold these points for 30 seconds and congratulations, you no longer have anxiety. I wish it worked like that. It doesn't. Usually in a session, what we do is we actually bring up all the stress that is contributing to the imbalance that we see in front of us. And then this is part of a correction. And so what we're doing is over time diffusing stress and allowing the body to come more and more into balance. But if all you did was do this correction for a minute every day or two, would that help over time? I think it would. So I would love to hear your thoughts and your experience with this. You can always get a hold of me on all of the various socials. I'll show those in a second here. And also, I just want you to know I've mentioned that this is part of the GEMS Elementals workshop. We teach that in a couple different ways through the GEMS College of Energy Medicine. One way is through actual workshops. So those happen both in person and online. You can contact us to find an instructor near you who might have classes coming up or what we have coming up in the calendar in the near future. This is also a self-paced class, and a self-paced class just means the class has been pre-recorded, so we have videos that you can watch online. We send you the source material, so we send you the manual, and then when you're finished going through the class, you can get a hold of me and we can spend a few minutes together online like this so that you can ask any questions that you have and we can touch base and make sure that all of the protocols and things make sense to you. So we have a coupon code right now. You can use GEMS Mental Health, as you see on the slide here, for an extra $50 discount on top of the price that's already on sale. So that's an option for you. And again, you can reach out to me at any of these websites or on Instagram at AC Specialized Kinesiology. So thanks and happy balancing. I'd love to see how this is working for you.